Okay, so this is chapter 17, which is innate non-specific host defenses. So the concept of immunity is that susceptibility means that you have a lack of resistance to a disease, so you're susceptible to it. If you have immunity, of course, as you guys know, because of COVID-19, you are able to ward off that disease. So innate immunity, this is something that we are born with, so it's been present since birth. No specific recognition of a microbe. It's just designed to prevent microbes from accessing the body and help eliminate those that do have access. Adaptive immunity is where we are going to be specific about a pathogen and it involves antibodies. So innate immunity, first line of defenses are skin, mucous membranes, and their secretions, which can be antimicrobial. And our normal microbiota, which compete with the pathogenic um, bacteria and microbiota that enter into or try to enter through our first line of defense. The second line of defense is going to be phagocytes. These are neutrophils, eosinophils, dendrites, and macrophages, and we can add to that list B cells as well. Inflammation is also a second line of defense. Fever is a second line of defense, and antimicrobial substances are second lines of defense. And there are specialized T lymphocytes and B lymphocytes for adaptive immunity, and we use antibodies. So the concept of immunity really boils down to always remembering this, that a toll-like receptor, which is a TLR, says it over here, looks for things to bind to, which are pathogen-associated molecular patterns. So these are patterns that are on the pathogen that our toll-like receptors on our white blood cells recognize. When they bind, that causes the release of cytokines, and it also causes things like PPP, which is phagocytosis, processing, and presenting to happen. So always remember, it's a toll-like receptor binding to a PAMP. And those PAMPs are things like LPS is a PAMP, flagella is a PAMP, the peptidoglycan that makes up the NAM-NAG from the cell wall, the DNA and RNA of bacteria and viruses, these are also PAMPs. And there are certain specific regions of the fungi and parasites, excuse me, that are also PAMPs. So these toll-like receptors, when they bind to a PAMP, they cause cytokines to be upregulated, and then that upregulation will recruit more immune cells to that area. Okay, so the first line of defense is physical factors like skin and mucous membrane. Skin, the largest organism in the body, the largest organ in the body, sorry, contains dermis, which is our connective tissue, and epidermis, which is the top dead layer. Keratin is a protective protein. Mucous membranes are membranes that are not composed of dermis and epidermis. And things like Treponema pallidum, which causes syphilis, can burrow through these mucous membranes. Mucus serves a purpose. It traps microbes, and it's produced by the goblet cell. So essentially, it's like a slime layer that captures microbes. The ciliary escalator we'll talk about more, but that's in the lungs, and it's to move debris away from the lungs. So the lacrimal apparatus, this is washes the eyes and creates tears, and the tears has lysozymes in it that actually are going to be antimicrobial. Saliva washes off microbes. Urine pushes microbes out. Vaginal secretions also pushes microbes out. Earwax flushes out the ears, and defecation flushes out the gut. So the lacrimal gland looks like this. You guys probably know that because you've gone through anatomy. The cilia on the respiratory tract is these little hair-like structures that protrude out from the epithelial cells there. So here is that cilia, and you can see that there's pathogen attached to the cilia. The cilia will beat in waves and push the pathogen up and out of the respiratory tract to be pushed out as phlegm into the esophagus. So chemical factors are fungistatic or bacteriostatic things, which, fungistatic and bacteriostatic don't kill them, but they cause them to stop growing and be in a static state. So there's a fatty acid in sebum, which is made from sebaceous glands, which also prevents hair from drying out. That fatty acid has antimicrobial characteristics. The skin itself has a low pH. which is not optimal for pathogens. Bacteria have adapted, of course, to these evolutionary trends that we have, and they metabolize that fatty acid sebum, and that then causes an inflammatory response that leads to what we know as acne. And so because these bacteria have evolutionary mutations that allow them to then metabolize that fatty acid of sebum, they then cause us to have an inflammatory response because the protective layer is then being lost, and that causes acne to show up. Accutane, the acne medication, prevents sebum formation so that that particular type of bacteria cannot metabolize sebum. So then you have less inflammation and less acne. Lysozyme in perspiration, tears, and saliva and urine breaks down cell walls by destroying chemical bonds of the peptidoglycans, so it's going to attack bacteria. The low pH of the stomach it's created by gastric juice. Most pathogens that are not used to being flourishing in that area will not be able to survive this low pH. And the low pH of the vaginal secretions also creates a non-optimal environment for pathogens. So sebum we talked about, the pH is low. Saliva, lysozymes, urea is uric acid, which is a slightly lower pH than neutral. We have IgA on our mucous membranes to prevent microbes from attaching. So gastric juice can't stop botulinum or Staphylococcus aureus toxins because those are impervious to the gastric juice pH. And the reason why botulinum is because it can form spores, and it has exoenzymes that actually neutralize the gastric acid as well. H. pylori neutralizes stomach acid, which we talked about previously, and that allows it to flourish and destroys the mucin, the mucus, so they can attack the columnar epithelial cells of the gastric lining and cause bleeding ulcers. So normal microbiota is what exists in us naturally, and they compete with pathogenic pathogens. And so the vaginal canal has normal microbiota at a pH that's not suitable for Candida albicans. However, if that pH is thrown off, then Candida albicans can potentially flourish. E. coli that is not pathogenic in the gut prevents Salmonella and Shigella from growing because it competes with it. So we have E. coli in our gut that's non-pathogenic, and it prevents Salmonella and Shigella and other E. coli strains from flourishing. So commensal microbiota, this is one organism, microbe benefits, and the other host is unharmed. So there are opportunistic pathogens. These opportunistic pathogens, if there is given a time frame where they can flourish, they will. But because they compete with our normal microbiota, they typically do not flourish because they're constantly in competition for nutrients. Probiotics and prebiotics prevent Salmonella enterica from growth during antibiotic treatment, so you should definitely take probiotics or prebiotics. Lactic acid bacteria, typically things like Bacillus strains that are found in yogurt, are also good for during Salmonella treatment. They may also prevent Staphylococcus aureus wounds by causing competition for the Staphylococcus aureus. And some studies have shown that HIV can be prevented by having to compete with, and remember HIV is a virus, but it competes for binding with some of these LABs, these lactic acid bacillus. So neutrophils, highly phagocytic. So they are a large portion of the blood. We'll talk about that in a second. Eosinophilia is always due to allergies or parasitic infection. So monocytes, these leave the circulatory system, they mature into a macrophage, and when they leave the circulatory system, they are going to do phagocytosis on a pathogen. The lymph node swells during infection because you are making more white blood cells. Dendritic cells, these look similar to dendrites. These have the ability to do phagocytosis. And I want you guys to remember that the lymph dumps into the circulatory system, which then can let things out during vasodilation into the tissue, and then that can re-enter into the lymph. Remember this circulatory pattern. So neutrophils, 60 to 70% of a white blood cell count. Basophils,